So we're going to strap the Achilles for Achilles tendinosis. So with this, I usually put down a base layer, usually about 3 inches long. We're going to go from the inside of the Achilles at a slight angle upwards to the outside. So the base layer is just to keep the tape down and to protect the skin from breakdown. So we're just going to strap that down just at a nice angle like that. So then, trying to make sure there's no wrinkles, then we're going to take sport tape. Now this other tape is called cover roll or me-fix, either way. Then you're going to take sports athletic tape. And you're just going to take and add a pull across the Achilles, making sure this doesn't touch the skin. So if you're too long, you just tear a little piece off or cut. So you're going to run this tape across the inside of the Achilles, across at a slight angle up to the outside, and touching the ankle bone. So it's going to stabilize and hold off on the ankle bone. So you're going to have 2 to 3 layers depending on the size of the person. So you can see we're still adding the second layer across to the bone. Now that's slightly too long, so we're just going to make sure this doesn't touch the skin. So it's really important that the person or client that's taped watch in case there's a skin reaction, so you can instruct the client to make sure there's no rash, redness, or itchiness. The tape stays on for 2 days, and it's off for a day to allow the skin to breathe, and then you can tape it again the second on the 3rd or 4th day. So 2 days on, 1 day off, watching the skin for any reaction, redness, itchiness, irritation. When the person who has an Achilles tendinosis stands up, it should immediately feel some relief on there. If it doesn't feel relief, you've either done the wrong tape job or it's not pulling enough, and there's no point in strapping it if it's not providing relief. So we're going to do a version of a modified low dye technique that helps to support the arch of the foot. So there's 2 different things you can do. You can do straight modified low dye, but in cases of plantar fasciitis, Brian Mulligan uses a technique that locks down the Achilles the calcaneus into inversion as well. I'm just going to show the modified low dye technique by itself here. So what we're going to do is cut some cover roll or me-fix as anchor layers for the foot. 1 layer protects the Achilles. So we're going to put that in place, the back of the heel and the Achilles. That just protects it from the tape that we're going to use. We're going to put a base layer at the forefoot, at the base of the forefoot. The idea of this technique is to support the arch. There's variations on this technique. I use this one technique I'm going to show because it's the simplest and quickest way to tape this. Now we're going to use 3 layers of regular athletic tape. We're going to draw across the arch, so we're going to anchor at the bottom piece. Draw it across the arch of the foot at an angle to support. Then we're going to tear. From that, we need to anchor this piece down. So we can add an anchor drawing in across to support that tape. Each layer that we put down, you're going to have 3 different layers like this at 3 slightly different angles, and lock it down or anchor it down with another cross layer. So I tend to go alternating directions on the arch support. So I'm going from medial around to the lateral aspect, then I'll go to the lateral side and across into the medial side, and locking each layer. And depending on the size of the person, again, whether you do 2 or 3 layers is optional. The other thing is some people will make a smaller band, so you'll tear the tape midway and run it across. To me, I find that's almost redundant. I can use actually less tape, use less strips if I'm going with full strips of tape. Now, the last thing is, we'll lock this down and then we close. So we're just going to overlap each layer as we're closing by 3/4 to half overlap. And we run all the way up to the base of the heel to close that. final step that I would do is running a layer of Coverall or Mefix across the sides on each side so that this stays on in the shower and doesn't come off as readily. You can always lay a layer of Coverall across the top as well to help hold things down. So when this gets wet, you can actually support it. The person can just towel dry or damp off the dryness, and you don't have to worry about it coming off in the shower. This helps support the longitudinal arch. It's pretty useful and easy to do. So this is an ankle taping technique for lateral ankle sprains, anterior talar fib, usually the most commonly sprained ligament of the body, and calcaneal fib second. Now, what this technique is, it's a mulligan technique. It's no longer using the classic locking. Brian Mulligan's idea, theory, is that the ankle subluxes forward and down, so anterior inferiorly. So we're going to strap the ankle by repositioning the fibula on the tibia. So we're going to have an upward glide, so it's kind of superior and medial, that direction down. So we're going to put a base layer of Coverall or Mefix down. This is going to go at a slight angle, so we're going to go off the lateral malleolus. Can you slide down just a hair more? Right there. Off the lateral malleolus, anchoring there, across to the other side of the foot, to the medial side of the tibia, making sure that we're on one bone to the other. So when they overlap, they should be slightly overlapped, but not crossing the leg all the way. We could add another layer a little longer, just in case there's athletic tape that covers the skin. So we're going to take the athletic tape, we're going to anchor this down here. What we're going to do is, this can be done as a two-person by doing a strapping glide and push, or a single person, strap, hold down, give a good pull. Now I'm giving a glide with my right hand, a force that direction. Okay, I'm going to take the tape, pull it snug all the way across and onto the tibia and cut. I'm going to do the same thing. Again, exactly the same thing, depending on the person, 2 to 3 layers. Again, we're going to come across and tear. So you're overlapping about a quarter to halfway across on each one. Once you're done taping, you can put another layer of Coverall or Mefix on the ends so that it stays on in the shower, just to hold that down in place so a person can shower. This taping technique stays on for 2 days and comes off on the 3rd day to allow the skin to breathe, and it's returned on 2 to 1. 2 days on, 1 day off. Now, you can instruct your patient or client to wash the skin, make sure there's no redness, no itchiness, or no irritation that could be skin irritation. Making sure there's no rash.